Good afternoon, I'm Anthony Lugg with the Midday News. Here's what's coming up in the bulletin. Junior doctors stayed sick out. Chaos at public health facilities across the island. And in sports, JFF announces 23-member squad for the Gold Cup. Now the details. Up first this afternoon, several junior doctors across the island have called in sick, causing major hiccups at public health facilities across the island. We visited some of the locations, but first, the Medical Association of Jamaica breaks down the impact of the industrial action. The sick-out reportedly started early this morning and is believed to be linked to the non-renewal of the contracts of 147 doctors, which expired at midnight. Talks between the Jamaica Medical Doctors Association and officials from the 4 regional health authorities ended yesterday without a settlement. It's believed that this is not going down well with members of the JMDA. President of the Medical Association of Jamaica, Dr. Andrew Manning, gave an insight of the implication of the sick-out.
Junior doctors play a key role in terms of the management of the patients in hospital on the wards, also in terms of the outpatient departments or the clinics, both in the hospital and outside, and also in terms of the running of operating lists and so on.
Dr. Manning added that the nature of the situation will have a major impact on patients.
You're going to have cutting back of elective surgeries, for example. Some of the clinics may have to be closed for the day, or just go to a mode where you're seeing the most urgent patients.
In the meantime, Health Minister Dr. Christopher Tufton says contingency measures are in place to deal with the fallout.
Public health is made up of several categories of doctors and nurses and other clinicians and their support teams. If one segment of that group decides to withdraw for whatever reason, it will be difficult. There's no doubt about that. But, we will do what we can in the interim.
The doctors have also been pressing for outstanding monies owed to them. To that, Dr. Tufton says a proposal was made.
I think this is untenable. I think the doctors have a very justified reason for arguing for their payment. They did work for it. And we made a proposal to them, the ministry that is, to pay those sums in installments over 2 months. And that was placed on the table. Plus, we will do some follow-up with the regional health authority to ensure that that doesn't reoccur.
As it relates to the contracts, another meeting is to be held to discuss the matter. Meanwhile, patients have been grappling with the impact of the sick-out. We visited the Mandeville Regional and Spanish Town hospitals earlier today. Here's Sandy Williams with that report.
Scores of patients turned up for their appointments at hospitals, but only to be met with dismay. At the Mandeville Regional Hospital in Manchester, the patients were told to reschedule their appointments as most of the junior doctors did not show up for work this morning.
That in itself is another setback, because you have to know to be off your job to come back for this appointment. Okay. They should do something for the doctors.
And at the Spanish Town Hospital in St. Catherine, the same story.
I have an appointment for today from my sister there, Holly Francis.
No, look at me, yeah.
And when I come, I don't get through. And she was in the hospital for 3 weeks. And today's the appointment day, and she has to turn back. And we thought her to carry her hair. Right now, we have to go take her to a private doctor because she fall down and bruise her face.
Senior Medical Officer at the Mandeville Regional Hospital, Dr. Everton McIntosh, says the facility is forced to suspend several of its services, including all electric surgeries and all non-emergency admissions.
Since 8 o'clock, persons have been calling in sick, or some just didn't turn up for work. So across all departments, there have been a large proportion of doctors who have not turned up for work, and it's apart the junior doctors. So the consultants are in post, and they're the ones now who are doing their best to cover the different areas. As a result of this, as you would expect, we are not able to maintain normal services.
Despite the consultants filling the gap, Dr. McIntosh says the hospital is under pressure.
It is very difficult because this is a fairly large hospital, and the junior doctors are the ones who carry the bulk of the workload in the hospital. So when they are not present, you will expect that we are just not able to function to that level. And unfortunately, lives will be put at risk. That is the bottom line. So we're doing the best that we can to ensure that we attend to any life-threatening matters.
He's hoping some level of normalcy can resume soon. Sandy Williams, TVJ News.
The relaxed COVID restrictions take effect today, bringing an end to the closure of the entertainment industry. We'll have details and we'll be reminding you of those revised measures in just a minute. But we now go to a story where there are repeated appeals for Jamaicans to adhere to the COVID-19 protocols.
The Montego Bay hip strip in St. James, now a shadow of what it used to be. That's expected to change now that the COVID measures have been relaxed. For the recently re-elected president of the Montego Bay Chamber of Commerce, Janet Silvera, even though the country is opening up, the protocols must be adhered to.
People should not let down their guards. They should ensure that they continue to wear their mask, continue to sanitize, and continue to social distance. Particularly if you are one of those persons who have decided that you are not going to get vaccinated anytime soon, because COVID is still here.
She also reacted to concerns by some health experts that it's still too soon for the measures to be relaxed.
But businesses need to do business right now. And to go and tell you that I would be against the government, then I would be going against my members. And I'm not willing to do that.
In St. Anne, Mayor of St. Anne's Bay, Sydney Stewart, says the municipality is prepared to work overtime to ensure all protocols at events are adhered to.
We will have to do our major surveillance, regular surveillance, to ensure that these people do not exceed the numbers that are given permission to really accept on the premises where they are conducting functions that they're having. We have to make sure that we ourselves take note of the fact that there has to be well-established sanitization stations and the regular announcement of the social distancing.
He also offered advice to promoters of entertainment events.
Don't advertise excessively so that once your patrons start coming, it's unmanageable for you. Make sure gradually what you're doing, because if we act with that level of discipline now, there's going to be more and more relaxation coming that gives you room to be able to accommodate more people. So I beg all the promoters just to comply.
Janella Precious, TVJ News.
And we go now to a previous story where the relaxed COVID restrictions take effect today. Prince Moore has the details of the revised COVID measures.
Funeral services will be allowed with a maximum of 30 persons present inside the church, other place of worship or funeral home. The limit includes mourners as well as clergy and support personnel. For burials, the maximum number of persons who may be present at the graveside has been increased from 15 to 30. Burials will be allowed Mondays to Fridays. The operating hours for markets and vending in public arcades and public transportation centers will be from 6 a.m. to 7 p.m. on Mondays through Saturdays. Markets will remain closed on Sundays. Amusement arcades, which cater for young persons, are allowed to reopen under COVID-19 protocols. Beaches, rivers, zoos, water parks, and attractions will be open from 6 a.m. to 6 p.m. on Mondays to Saturdays and 6 a.m. to 5 p.m. on Sundays, given the change in curfew hours. Parks, gyms, and bars are subject to the existing restrictions and protocols and must close at least 1 hour before the start of the curfew. Prince Moore, Radio Jamaica News.
And to the latest COVID figures now, 42 new cases of the virus were confirmed on Tuesday from 794 samples. The country's overall case count is now 50,166. The positivity rate now stands at 5%. 5 deaths were reported in the last 24 hours, bringing the death toll to 1,080. One of the COVID-19 related deaths was previously under investigation. In the meantime, 106 persons are hospitalized with a respiratory illness. 11 are critically ill. There are 18,533 active cases. And it's now time for a break, but stay with us. More stories when we return.